Diabetes is fast catching up in the developing as well as the developed world. And we must understand what are the oral medications that our doctors are prescribing us. Obviously, insulin remains the gold standard treatment for diabetes mellitus type 1 as well as type 2. However, the doctors initially start with oral medication for type 2 diabetes mellitus. And what are these oral medications? So the oral medications of diabetes mellitus type 2 are broadly classified under 4 major headings. The first is the type of drugs or the types of medicines which increase the secretion of insulin. The second are the types of medicines which decrease the insulin resistance in the body. In type 2 diabetes mellitus, insulin resistance is the major problem. The third are kind of medications which decrease the absorption of carbohydrates and glucose in the intestine. When you consume food, these medications reduce the absorption of glucose and carbohydrates. The fourth medications are Uricosurics. What they mean is they actually help in excreting out glucose through urine, through kidneys. Glucose is excreted out from the body. Hence, these are the 4 major categories of medications. When we talk about medications which increase the insulin secretion in the body, these are broadly classified under long acting and short acting. Long acting means their effect remains in the body for 12 to 24 hours. And these are mainly the glimepiride and glycoside. These are sulfonyl urea kinds of drugs. Then the second kind of medications are the gliptins. Vildagliptin, sitagliptin, tenigliptin and linagliptin is the latest addition to this category of drugs. These are long acting oral anti-diabetic drugs which increase the insulin secretion. Then we talk about the short acting insulin secretion drugs, which are basically rapiglinide and natiglinide. These are short acting, means their action remains for 3 to 4 hours, and these are generally prescribed by doctors just before meals, every meal, morning, lunch meal and the dinner meal. So these are taken just before meals to increase the release of secretion of insulin as soon as the person consumes food, so that the glucose levels remain under normal levels. So this was about the drugs or the medicines which increase the secretion of insulin. The second category of drugs are drugs or medicines which decrease the insulin resistance, which is the major problem in type 2 diabetes mellitus. So again, these kinds of drugs are divided into long acting and short acting. The long acting would be pioglitazones and other glitazones medicines. However, these kinds of medicines have a lot of side effect, and hence doctors refrain from starting the glitazones early in an anti-diabetic medication curriculum. So they wait for some time to see if there is no response by other medicines. Then only doctors would start with glitazones, because the side effect profile of glitazones is very high. Then the short acting one is the most commonly used drug or the medicine, which is the metformin. I am sure every diabetic patient knows about this particular drug, which is metformin, which is the first and gold standard oral anti-diabetic drug used to decrease the resistance to insulin in the body. However, with metformin, few patients have intolerance in terms of diarrhea or stomach flatulence, stomach disturbance, and few patients also have vitamin B12 deficiency. So we need to take care of these symptoms or side effects of metformin whenever someone is taking this drug metformin for decrease in insulin resistance in the body. The third is the kind of medicines which reduce the absorption of glucose or carbohydrates within the intestine when someone consumes it. So these are acarbose, voglibos. These are the kinds of medications which actually remain in the intestine. These are short acting and just given before the meals like morning, lunch and dinner meals, so that it reduces the absorption of glucose as soon as the person takes in food. Then the fourth category are Uricosurics. Uricosurics are medicines which actually help in releasing out or excreting out excess glucose through the kidneys in the urine, and these are basically the glozulins medicines like the empagliflozin medicine, Jardians, or these are the Invokama. These are the popular brand names of these medications. So these are the medications which help in excreting out glucose from the urine. However, theoretically there is a side effect of these medications, that because they are helping out excrete glucose in the urine, hence they can cause UTI or a urinary tract infection. However, that said, these are potent anti-diabetic drugs and doctors are using it potentially for patients who are not able to control their diabetes on the initial startup medications. So now we understood the four categories of medications. Now, how does a doctor decide which medication to start? So initially the doctors would prefer to start with the insulin resistance medication, means the medications which reduce the insulin resistance, and Metformin is the gold standard treatment started by any doctor at the first step of witnessing a patient with type 2 diabetes mellitus. Then if there is no control, then the doctor shifts to insulin secreting medications, means medications which are helping in secrete insulin. So they start either with glimepiride and gliclazide. Then they add another long-acting insulin secreting medications like the gliptins, vildagliptin, sitagliptin, or the linagliptin. Sometimes doctors do prefer to add short-acting insulin secreting medications also. Then the third medication that is generally added by doctors are either the Uricosurics or the medications which reduce the absorption of glucose. However, this decision is made by seeing the blood glucose profile of the patient. If there is a variation in the blood glucose profile just after meals, there is very high rise, then doctors generally prefer to add a glucose reduction, absorption reducing medication in the medication schedule of the patient. So friends, and potentially post, if there is no control, virtually with all the medication curriculum or all the medication combination that is started by the doctors, then the doctor would prefer to shift you over to an insulin dose along with the oral medications. So friends, this was from my side in terms of explaining you about the oral anti-diabetic drugs, and I hope you understood it well. If there's any doubt, please do mention it in the comment box. I would be happy enough to answer them. And if you like this video, please do like, share and subscribe, and don't forget to watch my next video. Thank you.